Some of the medical complications that can go along with an eating disorder really stem from either malnutrition or changes in your body's mineral balance. So if somebody is not eating enough, they tend to use their body's energy reserves, and we store energy as fat and as muscle. And so really one of the first things to go is your muscle mass. And so one of the complications people can have is really extreme fatigue and not having very much energy. They can also have a decrease in their heart rate because your heart's a really important muscle that works all the time. And that low heart rate can actually potentially lead to your heart beating irregularly and then even stopping. The other complications can be feeling cold, so poor circulation in our hands and feet. Sometimes we'll have hair loss. If a person's binge and purging, they can have disruptions in their dental enamel. They can have puffiness in their cheeks develop because our glands that make saliva have to work in overdrive if we're purging. If a person's taking laxatives to help them purge through going to the bathroom, then they can have changes in their electrolytes or their salt potassium chloride balance as well, which can lead to heart beating irregularly and potentially stopping. So those are kind of some of the major medical complications that can lead to ending up in the hospital. Some other complications can be having big changes in your blood pressure when you go from lying down to standing up. Again, your heart has to pump and compensate against gravity, and if we have low fluid in our body, like being dehydrated, then we can have a big change. And that usually manifests as feeling really dizzy, maybe fainting, passing out. For girls, one of the complications can be losing their period. So if we don't have enough body fat stored up, we don't have a menstrual period. And that lack of menstrual period can sometimes be nice. We don't have to deal with that. But on the other hand, estrogen is the reason why we don't have our period if we don't have enough estrogen. And that's a really important hormone for building up our bone strength. So people can actually be at risk for breaking their bones as well. And then along with those medical complications, we can have things with our mood. So oftentimes teens with anorexia or bulimia who aren't eating enough have really trouble focusing on schoolwork. What might have taken them half hour now takes them 2 hours, so their grades might start to fall. They might become socially withdrawn and isolated. They might feel depressed, have poor self-esteem, anxiety as well. So another point to make about eating disorders and weight loss is that it might not take a lot of weight loss to have some of the medical complications come up. If we lose even 10 pounds over the course of a couple of weeks, that might be way too fast for our individual body. So when we're looking at weight loss for people who might be overweight, we really focus in on saying, okay, I don't want you to lose more than 1 to 2 pounds a week. And if your teen is losing more than that, it's probably too fast and you should take them in to see their medical provider.